we created HealthWorks Franklin County as a health in all policies initiative. Under that umbrella, we use that to bring together all of the organizations, public, private, here in our county, to say, as we do our work, as we do projects, as we implement any type of body of work that we're doing, we want to think about health, we want to think about data, we want to think about policies, and we want to all be on the same page when it comes to those things. So that's what HealthWorks Franklin County does. It gives us that platform to address issues within our county, so that we're all rowing in the same direction. Someone over here isn't addressing the same issue that two other organizations are addressing, but they're all going in different directions with it. So that's what HealthWorks Franklin County was meant to do. It is a collective impact coalition. So any of the about 70, there's probably more organizations that are engaged and involved, but any organization can bring an initiative, they can bring a policy, they can bring, a project to the coalition, and we look at it, we hear what their thought, how they're wanting to proceed. We provide feedback and input, and then sometimes we collaborate on resources and funding for that initiative. So as we were talking about taking our community health assessment, the 4 priority areas, to HealthWorks to create a community health improvement plan. So the assessment, that's just the first part. Now we want to create a plan to address those priority areas. So we thought HealthWorks was the perfect coalition to work on that. Again, I will say, I talked about public-private organizations being a part. Any community member of Franklin County can also join that group. And again, we can share information on HealthWorks and how you can become a member of HealthWorks if there's an interest. So here's where, even though we did one collaborative assessment, when it comes to the community health improvement plan, there's a little difference. This is where we all do have our separate chips. So Franklin County Public Health will have a chip, Columbus Public Health will have one, and then all of our hospital systems have their own chips. So you say, well, why did you guys do all that work coming together and now you're separating? It's because we're all sort of governed under different standards. So for the hospitals, the IRS specifies to them how they have to do their community health improvement plan. For both local health departments, the state dictates how we move forward, and they ask us to align with their SHIP, which is the state health improvement plan. In addition, as I previously indicated, we serve different jurisdictions. So we do like to take that into consideration. So what Columbus and Worthington may need might be a little different than what the rest of the county needs. But we didn't want to get so far away from doing this collaboratively. So we created a framework. We said we're going to have separate chips, but there's going to be some specific things that we're going to do as part of that chip. And so one of the things that we all agreed on is that as we're creating our chips, we're not going to have Franklin County Public Health convene a meeting, a separate group, and we talk about what we're going to do, and Columbus Public Health and the hospitals. No, we're still going to use HealthWorks Franklin County as the one group. We're all going to bring our ideas, our thoughts as to how we're going to move forward with our chips. So we are doing that. We also said we need to be measuring this the same way. So as a group, the hospital council and the 2 local health departments, we said, let's select some metrics for each of those 4 priority areas to ensure that we are moving in the same direction, that we're measuring the same. And so then when we produce our annual reports, we're not reporting one metric and a different number than Columbus Public Health or the hospitals. So we came together and we agreed to that. And then we agreed that as we move forward, we all would get feedback from our stakeholders, community members. And again, we do that through HealthWorks Franklin County. So again, this is some of our shared framework metrics. I won't spend a lot of time on the data today, but again, if you look at our Health Map 2022, you will see what the data for Franklin County looks like for multiple measures. Again, I indicated we start with data. We want to always be data driven. So we start with data in public health. We have our epidemiologist who analyzes the data, and that's what tells us what are those critical issues happening in our community. So these are the agreed upon metrics that we currently have. And as you can see, we do struggle with how do we measure racial equity? What does that really look like? And so I would say to this group or those of you online, if you have thoughts or ideas about that, we are open because that one is a little bit more difficult. Our epidemiologists are looking into it. They're looking nationwide and at CDC and other entities like that to see how are others measuring improvement. So that's what makes it difficult. We want to measure improvement in all of these areas. I wanted to put basic needs, just show you a little data because this one aligns most with our conversation today and the conversations and presentations that you will have after this. Again, I'm not going to spend a lot of time or do a deep dive into the data, but I wanted you to be able to see what's a little snapshot of what's happening here in Franklin County as to why those basic needs are so important. So we know, I think everybody knows, housing is a major issue. At Franklin County Public Health, we have community health workers that work directly with individuals, residents of the county that are struggling. And we work with them on all types of needs. Housing is the #1 need that the majority of the individuals we serve have. It is also the one area that there's just not enough. There's not enough affordable housing for the individuals that we serve, those most at risk and marginalized populations. We struggle with that. And so this data shows you what that disparity here looks like. And it also shows you the burden that we experience in the county when it comes to housing. Again, as we think about food, housing and food, 2 critical basic needs that individuals have that, you can't get past those 2. If you don't have those 2, you are not living. And so again, there are some disparities that show up in regards to people having access to nutritious food. And again, if you think about some of our minority populations and their neighborhoods, there's a corner store. And what does the corner store have? It typically does not have your fresh fruits and vegetables. And if it does, they're going to be so costly that people aren't going to purchase them. I know given the area where we are today, many of you may remember when the Kroger's that was in the Linden area closed. That was a major deal. People in the community could walk to that grocery store. So having that closed was a big impact on individuals' basic needs. My time is up.
No, good.
Oh, okay. I'm sorry. All right. Just a few more. Yeah, you can't live in Franklin County these days and not know that there's a safety issue. Violence is going in the wrong direction. It is something that I know our city leaders, our county leaders are all working hard at, but it is a problem. And this just gives you an idea. And the really sad part of this is that it's impacting our young people. It really is. And that's something that we really want to get a handle on. This just shows you, if we look at the rest of the state, we're second here in Franklin County for having, increased or needing increased neighborhood safety. So second only behind Lucas County, which that's the Toledo area. So again, it's a problem. It's something we need to address. So we have our community health assessment. Now we've gotten together with a bunch of people through our HealthWorks Franklin County group, and we focus on developing the CHIP, our Community Health Improvement Plan. And this just shows you the process that we, go through when we're doing a CHIP. So, first of all, is just to complete that assessment so we know what the issues are that need to be addressed. Then recruiting community members, we do that through our HealthWorks group. Developing a shared vision. So that's all part of it. Again, our framework does that, but also our coalition as part of HealthWorks Franklin County also helps to do that. We prioritize the health issues. We had, again, kind of like a cafe style focus group as part of our CHIP process. We got a bunch of people together for 2 days. We spent together talking about, now that we know what these priorities are, how are we going to address them? Who's doing what already? What makes sense? How can we collaborate? Because a community health improvement plan doesn't mean you need to, start from scratch. It means what's going on now, who's doing anything in the space of basic needs or maternal and infant health or racial equity, who's doing some bodies of work. Do we all know about those bodies of work? If not, how can we enhance that work and really spread it and move it out? So that's what 2 days of a retreat, looking at the priorities, looking at strategies, looking at activities, and trying to decide now, how do we move forward? What do we really want to focus on? Because as you can imagine, when you get a room full of committed professionals, along with a room full of residents who are really committed and wanting to see change, you've got a whole big long list, but you can't do everything. So you have to prioritize what you are going to do and how you're going to move forward. So that's where we are now, creating those strategies, the activities, and looking at, are there additional metrics that we want to implement? Because we want to be measuring improvement. And I know you've all heard, if you're not measuring it, it doesn't count. And then what you measure usually gets funded. So we want to be measuring what we're doing. Step 5 is now with Franklin County Public Health. So we had a consultant that worked with us, helped for that 2-day retreat of bringing everybody together, getting all the feedback and input. Now we have a good picture of what's occurring across Franklin County. And now it's up to us. under Joe's leadership. Now our staff, we have to decide what's going in the Franklin County Public Health Community Health Improvement Plan. And that's where we are now. We have a task for that to be done by next month. And then after that, we've got to track and report on the progress. So I would think at some point, once we have our first annual report, we want to share that with this group. Since we've talked about it here, that's where that accountability comes into place. And then this is just our timeline, kind of where we've been. All of this that I've kind of described has taken place over the course of this year. Right now, we're at the point where our senior staff, we're taking a look at all the feedback, the input that we received. We're looking at what's already been funded and how we can enhance that, what needs to be funded. And we're looking at how to move forward. And that will become our community health improvement plan. Once we have said, here's our priorities, here's the strategies under each priority, here's the activities we're committed to doing, here's our timeline, and then here's how we're going to measure it. And that becomes our chip. That chip will be going to our board for approval in August. And I'm sure we'll do some type of press release and make that available to everyone. And then sometime next year, about this time, we'll be working on an annual report. So that was a lot, I know, but that is the process. And we do this every 3 years. So we're working on that now. Happy to answer any questions you might have. Okay. All right. Yes.
And I would stand up, I should stand up. Pretty bad. Cramp on my foot. Recognizing you're only the messenger, right?
Mm-hmm.
So here's my issue.
Mm-hmm.
We put a lot of emphasis on maternal and infant health.
Mm-hmm.
I'm sorry, I can't breathe. I've been in healthcare for 25 plus years,
Mm-hmm.
and I still have, as of yet, seen us move the needle in this space.
Yeah.
So it's telling me that our funding and our interventions is not effective, right?
Mm-hmm.
So that's one piece of it. So a lot of times I come to these discussions
Mm-hmm.
and I feel like it's fluff, right?
Mm-hmm.
Because we have put millions and millions of dollars
Mm-hmm.
into maternal and infant health with no outcomes
Mm-hmm.
being produced.
Mm-hmm.
And so we continue to keep this as a priority with a lack of emphasis on the family structure, which is ultimately the problem.
Mm-hmm.
The majority of households, particularly in the minority space,
Mhm.
are women-led.
Mm-hmm.
And so I am curious, when it becomes the agenda and who's making the priorities, who's at the table?
Mm-hmm.
Because oftentimes I don't see folks that look like me
Mm-hmm.
who are at the table
Mhm.
making these decisions.
Mhm.
The priorities seem to be based on the fact that based on expenditure, but not necessarily need. And I do understand that many of us work in this spaces because we have to feed our family. But we have to do better in emphasizing what specifically are the needs of the community. And because it's their agenda, doesn't necessarily mean it's our agenda.
Mhm.
So 2 points to this. First of all, people in this space should look like the people that represent the community. And that's what we're not seeing.
Mhm.
Secondly, the agenda should be, and the priorities should be set on the things that we commonly know continue to be a problem.
Mhm.
When women are put in positions to run households, it is ineffective. So let's start there. Let's stop putting funding where we're not moving the needle. We persistently talk about outcomes, and in the last 10 years, our babies are still dying. So that would tell us that our interventions and our emphasis are not headed in the right direction. Thank you.
Mhm. So I appreciate your comment, and I will say this. So as when Joe introduced me, he talked about I've been in this work for about 30 years. So I will say this. I have been you. I have been the person that has stood up and said everything that you just said, and this was years ago, 20 so years ago. That was me, and beating the drum and saying, you know, we need to have people that look like us at the table. We need to think about more than just, you know, the clinical stuff that we're doing. And I agree, for the majority, it may not look like we have shifted. But as someone that's been in this work for 30 years ago, well, less than that, back when I was at the state health department, we weren't addressing basic needs. And all of us, and I will say this, and you know, no offense to anyone, all of us who looks like me, who looks like the people that are experiencing most of the disparities, we were saying, if we don't address housing, if we don't address, you know, food, if we don't address economic stability, we're not going to make a difference in maternal and infant health. We were saying that, and it was going nowhere. But here we are now, and it is a priority. So I know it may not look like, and I agree with what the young lady said, and in talking with another assistant health commissioner who's over our prevention and wellness and our maternal and infant health, child health program, she's saying the same thing. She's applying for a grant right now because she's saying we've got to do something different. We've got to be more innovative. So we are saying those things. We are trying to push that agenda. We are trying to get more people who look like the people that we're serving at the table. So we are working on it. I know there's still a lot of work to do. There is. And that's where all of you, when I was at the state, I would actually say to people, your voice means more than my voice, because until the residents or the community members rise up and say, hey, this is not okay. It's not okay for Black babies to be dying at 3 times the rate of any other population. But until others stand up and say, this is not okay and we're not going to accept it, that's who our legislative body listens to. And so those of us who work in this space, we can make all the changes, make all the recommendations, but until the legislature says this is important, in Ohio, we will not have a rate of 3 times, you know, infant mortality for Black babies at 3 times the rate, until they decide that and really decide to support and fund the effort. We can only do what we can do. So not trying to cop out, but trying to say some things have shifted, and I've been in this space long enough to have seen it shift, but there's still a lot of work to do. If there are additional questions, I am happy to answer them, regardless of how tough the question might be. I get it. I understand the concerns that you're saying, and happy to have further dialogue with anyone. But thank you all for your listening and being here.
So thank you so much, and thank you for those questions. This is an advocacy breakfast. This is an opportunity to advocate and to have this dialogue. So this is really great. And Shirley and I really thought it was important that we present where we are with the chip, because this will be released to the community very soon with community input. Franklin County JFS is a great partner of ours, and we really appreciate that. But we do want to keep going, because I think we're scheduled till 11. We've got 2 additional speakers here this morning that are going to talk specifically about financial literacy. But now that we've sort of set the stage regarding social determinants of health and our community health improvement plan, We'd like to now talk a little bit more about financial literacy directly and how that impacts social determinants of health, specifically home ownership. Home ownership can be the quote unquote the American dream for some, but as we know, it can also be an unattainable for many. So to talk more about this, I'd like to welcome Lori Lindsay, a community home lender at Park National Bank. And let me introduce Lori a little bit further. Lori has been assisting clients with their residential mortgages for over 20 years. She works with all loan types, including VA loans, FHA loans, conventional loans, and construction loans. Ms. Lindsay enjoys assisting, guiding, and educating first-time buyers and current homeowners throughout the mortgage process. Lori is also a retired U.S. Navy Chief Petty Officer with 25 proud years of service. And we thank you and honor you for your service to our country. Her goal is to make the mortgage journey rewarding and valuable for her clients. So please join me in welcoming Lori Lindsay.
Well, good morning, everybody.
Good morning.
All right. So first, I'd like to thank Primary One Health for inviting Park National Bank. I am as you mentioned, a community home lender with Park National Bank. And I'd like to thank them for offering this opportunity to speak to you all about financial literacy. It has been a passion of mine for a very long time. I grew up in Youngstown, Ohio. I went to the military right out of high school, and then I did both active duty and reserve duty. So after my reserve duty, active duty, I moved here. But I've been here now longer than I was in Youngstown. But I grew up not knowing anything about financial literacy. I joined the military, and their idea of savings was savings bonds. And you stay till you're 20 years and get your retirement. That was your two options. I didn't know anything about a financial planner, an advisor, stocks, bonds, 401. I knew nothing of that. And there's still a lot of people today who don't know about that. They come to and sit at my desk. I talk to them over the phone. So everyone who's in the sound of my ear is going to hear my mouth about saving some money and being a little bit more responsible. So you don't have to learn the hard way. We want to learn it easy. I remember when I was 21, I believe, I was in the Navy. I was stationed on the ship, and I wanted to buy a car. And they needed a down payment. It's only $500, right? This is in 1991. And called my dad. I walked down to the end of the pier and called him on the payphone. Dad, I found this car I want to buy, but they need a down payment. It's only $500. Can I borrow it? I'm his favorite daughter. Okay. I have 11 brothers and sisters, and every one of them know, whether they want to admit it or not, that I'm the favorite. And I don't ask for much. So this is an easy yes. He said, let me think about it. I said, okay. So I had to wait a week and walk back down to the pier, put my money in and call my dad. He said, I'm still thinking. I said, okay. So now I'm getting a little irritated because this should be an easy answer, right? Because I'm favorite. Walked back down the following week, and he says, I thought about it. No. You could have told me that in the beginning, sir. He said, no. He said, if you want something, then prepare for it and plan for it. You in the Navy, you have a job. You live on the ship. You don't have no bills. Why don't you have the money? I was not happy, but I'll tell you what, from that day on, I prepared and I started. Okay, I got better later. I wasn't perfect with it. Okay. So, but I started thinking that process. And since that day, that's what I've done. And so that years and years later, I had an issue with the home that I bought. The water line in my yard broke, and it was going to be a nice little cost. And I talked to my dad about it because his trade was also plumbing. And he's like, oh, that's going to, he said, you need some help with that? Now he want to give me money. I said, nah, I got it. You remember you told me? He don't remember it. He didn't teach that same lesson to the other siblings too. I point that out to him all the time. Yeah, you forgot to teach them that, Dad. But I have some notes. So if I'm looking down, that's because I want to try to hit on everything that I wanted to talk to you all about. So my experience as a loan officer, I've dealt with folks that don't know anything about the process, don't know anything about their credit or where it needs to be, to those who may know a little bit of something, all the way to those who are already experienced home buyers and have been through this process. So I can speak to all of them at the level that they're at. I've learned that throughout these years. Now, my focus today is to talk about finances, savings, you're getting yourself financial literacy, getting yourself in a position to hopefully become a home owner. Everybody needs a home. That doesn't mean everybody needs a house. My mama was one of them. She didn't need no house because we lived in a house, but she never owned it. But she wasn't financially in a place, mentally financially in a place to do what she needed to do. That's a lesson that I learned now looking back at why she didn't teach me that, because she didn't know. You don't know what you don't know. So, but I'm here today. So everything that I'm saying, you all take some notes, some mental notes, and you share it with your community, with people that are in your voice, so that they're not in that same position. So what do? We stay ready, so we don't have to get ready. Who's going on a vacation this year or next year? Hands. Yes. Has it already been planned? Yep, it's already been planned. You done thought about where you're staying. You may have looked at the price of it. You may have even bought your tickets or booked your reservations. I'm going on a cruise next year. It's already done. Got it planned, paid for. Everyone have a car in here? No, we got to get your oil changed, don't you? We already know when we have to have that annual appointment. My appointment is set for next year already for my annual visit to the doctors. All of those things we're preparing for it. We're planning for it. But we don't plan for buying a house. A lot of people don't plan for buying the biggest thing that they'll ever buy, the most expensive thing that they'll ever buy. And what I see is the biggest hurdles are 1, savings, and 2, credit. That's the biggest things. And we gotta practice at it. When I was in the military, we trained all the time. When I'm on my job, every couple of months, there's a training that pops up and I'm like, golly, I got to sit through this. I can't even click to the end. I got to sit through it and do it. As a loan officers, there's legally things we have to do each time. And I'm sure on all of your all's jobs, you mentioned you're in healthcare, you're a nurse. There's some type of trainings and everything you all got to go through, I'm sure. I don't know if you said nurse or not, but you're in healthcare. So it's always something that we have to do to train. So let's train our bodies, let's train our minds, let's train us so that we can be prepared to buy that house if that home ownership is what your dream is. How do we do it? I have one word to say how we do it. Anyone know? Anyone guess? Throw it out there. This is interactive here with me. Interactive. What's the way to do it?
Plan and save.
Plan and save. And how do you do that? Discipline. Y'all heard I was in the military, right? Discipline. I'm gonna give you an example. I talked to a young lady who I gave her credit homework. This is what you need to do to help build your credit up. I'm gonna speak back to you. We're gonna set an appointment and I'm gonna call you in 3 months and we're gonna see what you've done. I called her in 3 months. She did 1 and 2, but 3 was to get a credit card. And she says, I haven't done that because I'm just nervous. I just think I'm be wasteful with it and spend it. And I said, what I'm hearing you say is you want to continue being a renter. That's what I'm hearing. Because if you're telling me that you want to buy a home, then this is what you need to do to get yourself in a position to buy a home. Discipline. You got to establish the discipline in yourself. I can't do it. We already know, as Sis in the back pointed out, there's a lot of racial and inequalities, right, that happen in every aspect of our society. Does it happen in banking? Yes. Is it supposed to happen? No. Are there rules put in place so that it doesn't happen? Yes. Does it still happen? Yes. So what can we do when those things are already in place? We got to handle our business ourselves. It's no one else's fault that you didn't save any money but yours. So that part of it, let's put it on us. Let's put ourselves in a position so that we can do the things we need to do. As my daddy had said, do the things you need to do so you can have the things that you want. So how do we do that? Savings. You have your bank accounts. I talk to many people, mostly young people, who don't have bank accounts. They'll just spend their money with their cash. They get paid, they'll cash their check. And let me tell you, it's gone in a hot second, right? They don't, I tell them, establish a bank account. There are people who have a fear of banks because of what happened in the past. And I get that. There are people who don't trust banks, but you don't have anything to show for it. So it doesn't matter. That's not, you don't have an argument. There's the online accounts, the chimes, I think they're called, they're whatever, but you can't even document the money that you have. And then when you come to me, you can't show me what money you have because it's in this type of account. again, plan, put yourself in a position so that you can get these things. So frivolous spending. Let me give you all a personal example, because I did learn from my daddy. However, I was talking to my financial planner and he was asking me about savings and how much I could put in here and there. And I said, well, I'll be good because I'm not really wasteful with my money. I'm a little, I don't like to say cheap, but I'm frivolous. I'm a little frivolous with my money. And so I went to my bank account and I printed out, old school paper, printed out my account and took a highlighter and just highlighted different things. I wanted to throw up in my mouth when I saw how much money I was wasting on fast food or on food outside of my house. And I'm a good cook. Why am I spending all this extra money? I added it up. And when I tell you I just said what I wanted to do. So knowing that, I share this with my clients too. Look at your money. Look at what you're spending your money on. And because I see it, I see the bank statements. I see how many times you go to Chipotle and Chick-fil-A and McDonald's and the grocery store. And then I see your bills. I see all of that. Discipline. You got to pull back. If what you want is home ownership, discipline yourself. Go to the grocery store, buy the groceries you need, and cook them. Stay out of the grocery store. Do it in small doses because cold turkey is hard for all of us. So do it in small doses, but get your money together. How much do you need to buy a house? How much down payment do you need? Question for anybody. How much down payment?
First time with 3%.
She said 3%. Anyone else? 3 to 5. See, you got experience back there talking about, oh. Anyone else? Most of the people I asked that question to say 20%. And that's not all conventional because you said that first answer was 3%, which is also conventional. So the minimum down payment can be just 3 or 3.5%, depending on which loan product, or if you're a veteran, or if your lender has any special programs, it may be no money down. Okay. So there's so much old information because it used to be 20%. That's not a wrong answer. It used to be 20%, but you don't have to have that much. So clients ask me, well, how much do I need to have? In the world, according to Lori, this is not according to any banks that I've worked with. I always tell people at least start off with 3,000 to 5,000. And that is not just for down payments and closing costs. That's what if money. What if that little boy and riding the bike down the street or throwing a football out there and it hits your big front window? Where's the money coming from? If you don't have 2 nickels to rub together in your bank account, how are you going to fix that window? You're not calling your insurance for it. What if the furnace breaks down and your home warranty is expired? Where's the money coming from? And it's winter. You got to have the money. So this is a cushion. And that's just to start with. Can it happen? It absolutely can happen. Everyone is not in the same financial situation, and I understand that. But do what you can do. Everybody can save. And it may just be a smaller amount, but let that just grow. Because again, I recognize everyone isn't making 6 figures or half of that. There are people that are at a much lower income bracket than that, but they can still save. Everyone can still save. It's just, it is a choice. It is a discipline. And that may mean pulling back on some of the things that you want. You can have all the things you want as first if you have the things you need. Okay. And one easy way to do that is auto payments. Auto pay, save yourself first. You got your bank account, set it up in there and just have your, whatever that money is going to this account. What are some type of accounts that people can have? I got one. She answered every question. Y'all slow in the back now. Come on, chime on in. You got savings accounts. What other kinds of accounts can you have money saved up in with your employer? Retirement accounts, 401. They even have online bank accounts. They have money market accounts. They have options. There are plenty of options. And you could just have it set to go so you don't have to see it. If that discipline isn't as strong as you need it to be right now, then you don't have to do it yourself. You can just set it up and you don't see it, it's gone. Okay. And a lot of those are pre-taxed. I'm not here to talk about any of that because that's outside of my lane. I have this shirt that says I may be wrong, but I doubt it. And I like to wear my shirt. So I'm going to stay in my lane. But you all can talk with your employers about that if that's not already set up. Let's talk about credit. What's a good credit score?
7.
Anything else? Can you get a loan if you're under 7-something?
Yeah.
Yes, you can. More important than a credit score is your credit picture, your credit history. What does it look like? What are some things that are bad credit, that we would deem bad credit? Repossessions,
Evictions,
evictions. What did you say?
medical bills.
Medical bills. And there's a change to medical bills. The doctors used to send it to collections just like that. And now it is a time period where they can't, I don't remember if it's 6 to 12 months they have to before they can send it to collections. And that's a new change. But bankruptcies, repossessions, judgments, all of those and more, the easiest thing, late payments. Late payments will get you big time. So the easiest way to hurt your credit is a late payment. The easiest way to keep your credit good is just pay it all on time. Same thing, one side or the other. And what I see is a lot of that. It is a lot of credit issues. And again, this is why we're talking about it. If you have a bill, pay it on time, every time, and try not to overextend yourself in that bill so that it's not such a hardship. You know, if you have a credit card, don't max it out, because that is another thing that will hurt your credit. And oftentimes people, you'll get this credit limit. You're new to credit, or this is a new card for you, and they may give you a small limit, maybe $500. And then you see something that you want and you go put 450 on it because you're not over the limit, right? But your credit is about to tank because you're over 30% of whatever that limit is. And that's going to hurt your credit score. So it has to be responsible habits that you're doing with your credit. Aside from paying it on time, don't put too much on those credit cards. You do need to have credit cards. You have to get credit and use credit to build credit. There are a lot of folks, a lot of rich folk out there. There's one in particular, I'm not going to say his name, and he has his whole thing about credit and how you have to do it. But he's already rich. He already got everything. So he doesn't have to spend money on or have to have credit. He can probably buy a house or a whole car, a whole brand new car with the money that he has. But regular folk, that's not what we do. We don't have that. So in order to get to that space, we have to have our credit. If your credit is already great, good. You don't have to use a lot of credit cards. But if you are at the point where you're trying to build it, you do have to use some credit. There's other means as well. There's others, what is it called? Experian has a free program called a credit boost. So this is information I really want you all to share with folks that are trying to build their credit. They have a free program called a credit boost, where you could list on there the items that you are paying. It's coming again out of your bank account. If you're paying it in cash, it's not going to work, but your rent could go on there. Your utilities can go on there. Your cell phone bill, your insurance, things like that. And it will boost your credit score. It will show on your credit report as a line item. And what that does is boost it because it's showing a monthly payment that you are making on this here. So there are several options out there. You just have to find them. I encourage everyone to pull your credit and review it well before you intend on purchasing a home, so that you know and you are familiar with your credit, because as we already know, there's a lot of fraud out there. Backstory, I found a letter that I wrote my mom when I was in boot camp, and she still had the envelope. My address had my full Social Security on it. That was part of our address for boot camp and my first and second duty stations. I don't remember credit way back then, but apparently it wasn't an issue. I didn't get my identity stolen, but could you imagine that today, putting your full Social Security number on the mail? Times have changed. So you have to be careful. I'm sorry, you have to be careful. So which is why it's important to pull that credit report, to review it, to look at it, because there may be errors on there and they can be fixed, but it's going to take time and it's going to take discipline, because the credit agencies and collection companies and all of that, they're not your friends. They're not there to help you. They're there to just report the information. So the work will be on you. That discipline is on you. Okay. All right. I'm going to keep it moving here. So to give you more time there, sir. So my takeaways: save, and tell everyone to do that. Pull that credit report, review that credit report, so that you know what is on there. Any questions? Yes.
Thinking about young people with families that are struggling, and sometimes they're in a rental situation where because of their credit, they're paying more. Maybe they're only allowed to do it once a month, so they're paying maybe $1,500 a month for a small home in a decent school district. And yet they can't put aside the money you're talking about for a down payment. Do you ever, as a lender, look at the difference between what someone might be paying in rent and how that could financially help if they were to actually purchase a home at a much lower monthly rate? Does that ever get taken into consideration as part of that process?
No.
Just trying to get people out of this rut.
Let me just be
Yeah.
completely clear with banks, with all lenders, with banks. You know, they're there to give you the savings account and help you buy a home and all that, but the primary purpose of any bank is to make money. And there are also regulations we have to follow. The ability to repay came out with the Dodd-Frank.
And
So
I
we do
think
look at that, but they have to be able to pay us back. That is more important than, yes, I know you're paying $1,500 in rent, and I know that this mortgage payment is $1,000. But do you, according to our regulations and guidelines, do you have the ability to pay back that $1,000? And we look at everything as a whole. It's not just one answer or one situation. How much do you have saved up? Did you go through a program to help you? You may not need that down payment because it may be a program that lender has that doesn't require any. You know, we do look at everything at every angle, and it may mean, okay, right now you don't have it, but here are some things that you can do. I know your money is tight, but put something, you have to save something, because some of these programs require that you have some type of savings. And, you know, it may be tight, yes, but pull back on something, put a little to the side. Yes. And you had a question too, sir. I'm sorry, one more, he had his hand up, go ahead.
Yes, okay, so I heard everything you say, and first off, thank you for your service.
Thank you.
One of the things that, in the very beginning of the conversation, you did speak about the, inadequacy of people and their understanding of finances. Okay, and particularly banks. For me, bank is a four-letter word. For most of us, I think we come from families where one thing that didn't get talked about at the dinner table was finances. If you don't have money, you don't talk about it. So therefore, I can remember if I would speak about money to my father, you know, that was a non-issue, so they didn't bring it up. So therefore now, obviously you come from a family who they're affluent. At that particular point, they're, yes, son, when you grow up, you'll get this and that stock and bonds, and you'll have this in the mutual funds. And for the rest of us, we didn't grow up like now. Unfortunately, I've been educated since, okay? And now when I teach classes, the one thing I do teach is that banks are a four-letter word. First off, when someone's giving you 1% or less, credit union is a little bit better, but obviously the money is in the market. Okay, so my basic question to you with Park National Bank, okay, what are you or Park National Bank doing to better make the conversation had amongst families about financial sustainability? In other words, we're all grown, most of us own a home, have a car, or whatever, okay? Well, the youth coming up, okay, the ones I see at Franklin County, okay? What are we doing to basically bring it to them as far as what you need to do? We can instruct older people all we want, okay? We pretty much have our mind in what we're gonna be, what do we do for the kids?
That's a great point. So what we do, aside from the customers that come in front of us, you know, we are speaking at different events such as this. We are working on different other types of events to get in the community. We also have right now we have a office in the St. Stephen's Community House, which is over on 17th and Joyce. And part of our process there is working with the community and helping them in this whole space. Not just doing loans, we're there in the community center working and helping with them. And doing what I do. You know, I can't speak for every other loan officer. I just know, as I said in the beginning, everyone in the sound of my voice in my circle, I talk to them about that. I've done programs in schools. That's one thing that we're looking at doing with Part 2 to do. I can't think of what it's called right this moment, but it's this budgeting thing. You give each of the students, they get a job on this piece of paper, they get a job and it tells them, this is what your job is, this is your income, this is how many kids you have or don't have, this is how much you bring home. And they have to go to all of these different tables to determine how they how much money they can spend. They have to find rent, a transportation. They have all these different options. That's something that helps them. But what I would encourage is we got to talk up at home. That's the biggest thing. We have to. We come from a community that didn't talk about, we swept things under the rug. We didn't talk about money. We didn't talk about Uncle John or Auntie such and such who did this. We don't do that. We got to stop that. We have to break that cycle so that we can help our kids coming up to get to where they're going to be, because there's no kids here. Right. So it got to come from down and I don't know, clicking them in the forehead and making them sit down and shut up and listen to what I'm saying. Sit down and listen to what I'm saying. We're going to do something. We're going to learn. So that part we got to do as a community and our families and to ingrain that in them. So because I was like you, I didn't know it. I didn't learn it. My mama didn't teach me that. My dad taught me it a little late, but I learned a lot of it hard knocks on my own. I didn't always have great credit. I didn't always pay my bills on time. But we learn, but we don't want them to make the same mistake. So we got to open our mouths.
First of all, I want to thank you for emphasizing the importance of family structure. From the previous conversation, again, I heard women. I like to also hear men occasionally every time. But the point is this, we emphasize savings, right? And while that is a key and fundamental element of home ownership, there's also a right time to buy and a wrong time to buy. And so we have to extend our educational components beyond that idea that if I save enough money, that I'm going to be able to afford this home. But how do I stay in this home? Because what happens is we're seeing a lot of folks purchasing home right now where the interest rates are 7% and above. And we know that in 5 to 10 years, all of those homes are going to be foreclosed. And so it goes beyond the saving element in terms of how do we teach folks how to identify loopholes that's going to put them in the best case scenario. Because while you can afford this home, if you purchase this home at this amount, how are you going to be able to furnish that home? How are you going to be able to have all the other necessities that you need? Someone once told me that if you go into New Albany, one of the most astute areas in Columbus, Ohio, you will find that the majority of homes are unfinished. And so I think we need to be just a little bit more realistic and provide the tools to how to maintain as opposed to just savings. So that's my point.
And there are a couple of organizations that we refer to, Homes on the Hill, Homeport, OSU Extension, and CMHA, and they do home buyer education classes, and they touch on all of those things. Because one of the things I tell to my clients, I don't want you to be a home buyer. I want you to be a home owner. That means I want you to keep it. I want you to establish those habits so that you know that you're going to maintain this, that you're going to be comfortable. A lot of people got champagne taste beer money, right? And like I said, like you mentioned with that savings, you got to have that for the what ifs. If you use everything that you have saved up for that down payment, how you gonna buy the paint for them walls and the Lysol to clean it all up with and buy new furniture because it's a new house. You don't want to pull the old stuff in here. You still want to have. So this is why that savings is important for the other things as well. Okay, it demonstrates to us that you have the ability to save, because most people who have the ability to save are people who are going to pay us back. And that's really what the lender looks at, who's going to pay us back and is it any risk for them. So yes, I agree with everything that you said, and those classes are out there. I have an email set up to that, I send it to all of them so that they could understand and know even deeper than where I'm going, because they go a little deeper. But you had a question.
But you mentioned credit and some things and young people. I'm older now, but in my early twenties, we talked about maxing out credit cards. It was really easy to max out a credit card, and then my really kind credit card company would increase my limit.
Yeah.
And then I would spend more,
Mhm.
and then they were really nice and they increased my limit. And I know it may not be the lane, you mentioned something about medical bills as well. But even talking about that predatory, like lending to young people on, hey, you maxed it out, here's $5,000 more of fake money to spend, that you don't really understand. Because like, in my early twenties, I had plenty of credit issues with credit cards. Older now and out of that, no better,
Mhm.
but I had plenty of issues. And, it was easy when I was
Yeah.
broke to swipe a credit card.
Mhm.
And my credit card company, I just was so kind.
Yeah.
Yeah.
Mhm. Yeah. And it's
Coming out of high school, we don't get financial education in high school.
yeah, no,
And
they doing some.
Whether it's college trade or straight to work, whatever,
Yeah.
the situation is. The credit card companies know that you turned 18.
Yeah, absolutely.
And so, it's just a thing that came to my brain as you were talking, is that someone should look at the credit card companies and say, leave the kids alone.
Yeah, and I'm
Kids, yeah, well, with college students, yeah, cool. Well, I don't know a lot about it, I'm so retired, but, in colleges now, they can't promote the credit cards the way they used to. Come, I'll give you a T-shirt, fill out this application.
When I was in college, Citibank hosted a concert tour. They brought it to my campus. I mean, it was really predatory. I know that, and lucky for me, I had guidance from my parents in ways, but I was so struggled and had to pay off some debts I couldn't afford to pay off. They longer than I cared.
Yeah.
So much to the young people now, and it just feels really bad.
It is, yeah.
That's a great thing. And, even with some of that technology now, like Snapchat, Venmo,
Mhm.
have to pay, they have all those features in there too, where you can pay later, or you
Yeah,
can find a way to, they give you a portion of money you can spend, and anyone has access, at any age to those types of apps, so.
this is why we gotta open our mouths and talk to our young people. And hopefully they listen. Like I said, you click them on that forehead. I'm a good clicker right there. I get them right in that gray, where the gray matter is. Get them right there and make them listen, because you don't know what you don't know. And it's so enticing. We've all been there. I remember filling out a bunch of JCPenney applications back in the mall in Youngstown. I don't even know if I was 18, but they had free gifts. I don't think it went anywhere, but I never got a card in the mail, but it is there. And we just really have to talk to them about the ramifications of it and what will happen, because it's not going, you don't want to start off your financial journey with bad credit. It's harder to come back from bad credit than no credit. Okay, I am done. We have a gentleman in the back here. Thank you for your time. I do have business cards. My information isn't on here. So if anyone needs a business card, I do have some here. And if you have any questions, please reach out. Thank you for your time.
Lori, thank you so much for that presentation. Again, thank you for your service to our country, and thank you for the wonderful information and great dialogue again. So this has been a really, really great morning so far. We are at 11, but we've been given approval to go to 11:30. So you've been kind enough to give us your morning already. You could stay for a few more minutes. We do have one more speaker this morning, which I think is going to be really, really interesting. And from my vantage point, very, very timely. The issue of gambling and problem gambling here in our community. We know that the law has changed here in Ohio with sports gambling. And this is something that I think a lot of families, and we sort of touched on, we don't talk about as much as maybe we need to. And so we're really, really fortunate to have with us an expert in the space, Bruce Jones with Mary Haven Gambling Intervention Program. Bruce is a licensed social worker and a nationally certified gambling counselor level 2, who has worked for Mary Haven since 2000. He saw the need for gambling services in Central Ohio in 2009 and asked Mary Haven to apply for funding to help those struggling with gambling addiction. And Bruce has been working with individuals family members, and communities ever since. And so, Bruce, I'd like to welcome you. Thank you for joining us here this morning to talk about a topic that I think is really timely and really important from a financial literacy standpoint. So good morning again.
Wow, my ADD is acting up. All these speakers before me got, oh God, I want to add that in, So I'm going to try to stick to script. I can say I pulled my phone out, but I usually wing it. So thank you, Primary One, Joe, for inviting me. Just at Maryhaven, we're celebrating our 70th year of as an agency. We're the oldest drug and alcohol mental health facility in the Central Ohio. We are a one-stop shop. We have our engagement center that brings people in that are intoxicated or indigent, and we offer services to them for their overnight stay, give them a bus. They usually come back the next night to sleep it off. But we do offer services. We have our detox, and right now, unfortunately, it's all about fentanyl, and we still get an occasional alcoholic or benzo person. But we have 3 residential programs, 1 extended housing program, and we're located in also Delaware, Morrow counties, and in Union County in Marysville. So we've expanded, and I've been honored to have been working there for 22 years now. It's a great organization. I would send my family members there. But what I really love is this is like my 7th job within Maryhaven. I've done the federal probation and Bureau of Prison clients with the drug and alcohol. I've done the admissions, the adolescents, back to admissions, smoking cessation over at St. Stephen's. Then back to ambulatory detox. And when they were going to put legalized gambling in Ohio, I'd already got a grant from the Columbus Foundation that gave us an opportunity to provide gambling treatment. And I was able to do 16 hours a week of gambling treatment, and the other 26 was, or 24, my math is, I'm a social worker, so math isn't my thing. So as ambulatory detox. But when 2012 came around, there was these commercials on TV and radio. You were here, you heard them, says, what's that sound? That's the sound of your money driving to Indiana, West Virginia, and Michigan. Vote yes on the casinos, infrastructure, money, job, blah, 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 blah. We bought the whole bill of goods. And that's when the state picked us up as one of the 6 evidence-based agencies in the state. Toledo, Cleveland, Youngstown, Athens, and Cincinnati were the first 5. Well, they were going to build a casino here in Central Ohio. It was a no-brainer. We got the contract, the grant. And then when the casinos had to agree that there will be no complimentary alcohol served in the casinos. Boy, did that piss a lot of people off. Come on. But you think about it. If you're drinking and you're gambling, what are the odds you're going to go all in? So they also had to agree to pay 2% of their taxable proceeds to the state for the prevention and treatment of addiction. And we're very fortunate at Franklin County. We received all the Franklin County's grant that allows us to provide the services at no cost, because I really don't know any problem gamblers that have extra money for treatment. In my career, when I first started Maryhaven, crack cocaine was the #1 drug of choice. I swear I've never seen a drug I considered a gangrene of the soul. What people did on the cocaine or the crack to get their fix. Then heroin came out. I've never seen a drug that brings people to their knees so quickly. And then with this gambling, I've seen sicker people with the gambling than I have with the drug and alcohol addiction and mental health. Very rarely do I get a gambler that's all they do. They usually have an addiction, a mental health disorder or diagnosis. So when I treat people, we do a full biopsychosocial spiritual assessment. And that just gives me a thumbnail sketch of where they are and how many How many of you grew up playing tonk or rummy or something like that growing up? So it's taught in the family. You know, gambling is so normalized in society. They say gambling right now is where drugs and alcohol were in the 1970s. You know, with old Nancy Reagan, oh, just say no. It doesn't work. But like Joe was saying, in this January, they legalized sports betting to the state of Ohio. It was the largest expansion of sports betting or gambling in the nation, what Ohio did. You know, we have 3 different types of licenses. Type A license, your app, in-game betting, next pitch is going to be a curveball, or the next batter is going to get a single, a base hit, first down, whatever sport you're looking at. And with addiction, if you know anything about it, the faster the stimulus, the faster you get addicted. So gambling is a hidden disorder. You know, if I'd been hitting my pint on the way over here this morning, I'd be slurring my words, my eyes would be glazed over, and you'd smell it on me. But gambling, there's no physical cues. I can't see gambling in your eyes. I don't smell lottery breath, and I don't see diamonds, clubs, spades, or hearts in a urine screen. So by the time people come for help, the damage is done. Loss of relationships, housing, jobs, money, payday loan, credit card with title loan place. Suicide becomes a very viable option for this group of people. It has the highest rate of suicidal ideation than any other addiction. So that's what got me working with this population. I'm not going to jinx myself and say, you know, that I haven't had anyone, you know, die on me, but gambling is it's not rocket science to treat gambling. You know, we don't have to recreate the wheel. There are enough modalities out there for drugs and alcohol. Even though it's a behavioral disorder, we're going to have the same modalities of treatment. So I pride myself as I get someone in front of me, I can make the sell. Yeah, treatment is good for you. I can do this. We can do the financial literacy. You know, I do the 101. But we do team up with, through our Franklin County Adam Board, we have a MOU with them and a prize in credit counseling, credit repair. So if someone's in our program and I refer them to them, you know, they take all their debt, all their income, and put it to an algorithm and come up with this plan. Okay, well, you give us $300 a month for the next 2 years, your debt will be paid and your credit score will be over 700. Or same thing, okay, you give us $3,000 a month, you know, maybe you can't afford that. Well, now, unfortunately, you're eligible for bankruptcy. So financial literacy is part of the gambling. You never hear of any financial advisor saying, well, take 10% of your income and invest it over at the casino. You know, it's not a good plan. But as far as a community health hazard, which it's not statistically there yet, but it's on its way. In 2012, the state of Ohio did a survey, did a baseline survey before the casinos opened. They got all the surveys back, they got the data. Wow. But it came back that 5% of the population of Ohio was at risk of developing a gambling disorder. 5 years later, 2017, they did another study, a survey that went out. And this time the casinos have opened. It came back at 10% of the population is now at risk of developing a gambling disorder. And the direct correlation, the only thing that happened is we legalized gambling, casino gambling. Going backwards a minute, before casinos, which had 2 owners, Penn Gaming and Caesars. You talk about monopolies in the state. They have complete control over casinos in Ohio. Their heads were swollen. We got the last gambling license that the state of Ohio is going to issue. Oh, we're going to make billions. And then the lottery stood up and said, well, wait a minute, we have a gambling license. So they opened up 7 racinos in the state. Scioto Downs is an example of a racino. You can be 18 years of age, bet on the horses, but you have to be 21 in order to go in and play the slot machines. So there were 11 brick and mortar gambling facilities in Ohio. All right, so guess what? It's been another 5 years. There's another survey out. We have not gotten the data back from it yet, but I can almost guarantee if it hasn't doubled, I'd be surprised that with this sports betting, they were able, even though it wasn't into effect, but sports betting has been going on for a long time. We brought in a couple of years ago fantasy sports. We know that's not gambling, right? So funny how the fantasy sports are now some of the largest sports books in the country. So I would be surprised if it's not 20% of the population is at risk of developing a gambling disorder. In 2015, I had a great prevention specialist, George Hicks. He was in the community. He teamed up with Capital University's School of Social Work, and they did an environmental scan on zip code 43207. That is where Mary Haven sits. It's Alum Creek, High Street to Groveport, I think it is. Low, maybe middle class economic area, high infant mortality, #1 use of Narcan. That's why we built our detox right there on High Street in the old community hospital. So how much would you think just for the lottery in 2015, how much money did that community spend on lottery? Just throw some numbers out. One zip code. $500,000,
2 million.
2 million. How about 15? And out of that, maybe $1 million came back to the community for ed schools. 2 elementaries, no, 2 elementary schools, 1 middle school, and 2 high schools. That means $14 million left that community. What can you do with an extra $14 million in 43207? Well, what my friend George had done, he started, give a tenth. So he went with the faith-based communities, take a tenth or a fifth of what you would spend on the gambling and put it into a rec center, put it into the church, get more community involvement. Needlessly to say, it took off. But then at that point on, the lottery stopped posting its zip code amounts because if they want to raise more money, they open more stores up in the lower economic areas, just like where these internet cafes are located. They are all eventually going to be shut down because a couple of years ago, they said you have to operate under games of skill, like Chuck E. Cheese. What's the other place? Franklin or Dave and Buster's. Thank you. And yeah, I'm spending money, but I'm getting these tickets. But you're still buying a $5 item for the $30, $40 you spend on these games. So they have to have a license, and they will never get a license because they are gambling. The Casino Control Commission, the Lottery Commission, the Racing Commission, and Ohio Mental Health and Addiction Services back in 2012 formed one agency, Ohio for Responsible Gaming. They are the ones that provide free resources to the state, pay for an annual conference every year, and the rest of the money goes to the 50 mental health boards in the state of Ohio to provide gambling services. Right now, we're able to do, free services, Franklin County, and with that, like I said earlier, being the fifth or the sixth evidence-based agency in the state, that little pocket of money, I can treat the Franklin County cluster. You know, people work in Columbus, gamble in Columbus, just because they live in Fairfield, Licking, or Madison, or Delaware, they should be able to get treatment here in Columbus. And our Adam board has, okay, we can do that. Well, that wasn't helping the rest of the state. So what the state has done now, and it's still not effective, even though the budget has been passed, the monies haven't been dispersed yet. So the agency I'm also on a board with is Problem Gambling Network of Ohio. And in collaboration with them and Zeph Center in Toledo, they are coming up with telehealth services for the state, because there's so many counties in the state that have no services available for people with a gambling disorder. You know, I just talked about a couple of things, you know, the lottery, casino gambling, and now the sports betting. What about the cockfights? What about these back, you know, poker rooms, things like that, that aren't so much regulated? Gambling, we've been taught as kids growing up. You know, I learned how to play, I learned how to count by playing rummy with my grandmother. You know, there's my numbers, you know. So gambling is the oldest entertainment in the world. So there's nothing wrong with gambling. I don't want to come off as, you know, I love to gamble. I just choose not to because Channel 4 breaking news, gambling counselor at Maryhaven wins jackpot, loses job, you know, I'm going to be retiring soon, but I want to go out on my terms, right? So, you know, it's, like I said, this is not rocket science. And what I've noticed over the 18 years I've been doing gambling treatments specifically is that gambling is usually a symptom of something else that's going on in their lives, whether it's relationships or the addictions or it's our mental health. But gambling, it's a vicious beast. You know, everyone starts off as entertainment, you know, it's fun. And then they, oh, well, now you're up to $35 twice a week. Come on, get the free play. And then, unfortunately, you might hit the jackpot. You're hooked. You know, oh, I've done it once, I can do it again. And that's my fear with this sports betting, because it's been illegal. But now we have all of our my generation and all that, you know, maybe we didn't have a bookie or anything like that, or weren't in an office to get the little pool going, you know? So, oh, let's try this. It's legal now. And what if they win? And, you know, maybe they don't know anything about addiction, but gosh, I love that. One of the things about gambling over the years, I've been asked to help people get treatment in lieu of conviction in the courts. The first time I was in a case in the eastern part of Ohio, an embezzlement from a charity. So I'm thinking, okay, I can help this lady. So I'm thinking, you know, new at the gambling thing. Oh, I've got my DSM-4 at the time, Diagnostic Statistic Manual, the 4th edition. Oh, gambling, pathological gambling. You know, I shared this and I was talking to the court until the district attorney's, you know, second in charge said, well, Mr. Jones, how did you diagnose this? And I said, well, I'll use the DSM-4. He said, is it this book? Oh, well, yes, it is. He says, he opens it up to the preface. Have you ever heard of the cautionary statement? No. He had it highlighted. Would you read this for me? And it talks in there that gambling cannot be used as a defense in a legal issue. So, but we still got it. We had a judge that had, you know, family history of addiction. But my fear is that it's the ease of gambling. And we know the faster the stimulus, the faster the addiction happens. Even though it's a behavioral disorder, it's right there in the DSM with addictions. It used to be in the 4, it was pathological gambling was with impulse control disorder, pyromania, kleptomania, trichotillomania. What is that? Anyone?
You're out.
Very good. Hair pulling. So, and pathological gambling. So when the fifth edition came out, they placed it with addictions. So gambling is with alcohol, cocaine, cannabis, opioids, and sedative hypnotics. Since then, the ICD-11 came out, another international diagnostic group, and they added 2 new behavioral disorders: sex disorder, internet gaming disorder. That's a tough one. And if you have grandkids or kids that have played Fortnite, Call of Duty, any of these games that are free, they have a loot box or a treasure chest in them built in. Anyone know what they are? No? Well, no, but it's free. If you get this opportunity, if you have enough in-game money, you can get it. But there's no guarantee you're going to get what you want. But you could still get a prize, a skin or a magical powers, weapon or something. But if you don't have the in-game money, guess what? You can use your real money to purchase the in-game money. And a rough definition of gambling is anytime you put something you value at risk on a chance for something more is gambling. So that is gambling. But at Mary Haven, we've, I bring talk into every week. I'm into a couple of different agencies around the state, and any opportunities I have, I'll be glad to come and talk about it because it's the hidden lion or hidden tiger, whatever it's called. It's going to get us. It will, because it's so normalized. It really is just insidious, but yet it's in all aspects of life. High school, community football, baseball, whatever, 50-50 raffle, is that gambling? The lottery. A lot of folks in different areas think, well, that's just what we do. But if you're spending, $200 or $300 a week on numbers or the scratchers, something's wrong. The thing that gets me the most, I think, is the cognitive distortions that come with the gambling. Most of our people are escape gamblers. They're not happy in their life. They hate their job. They don't like their significant other. They're in debt and all this. But when I go to the casino, I'm having I'm having a relationship with an inanimate object. And guess what? I'm not thinking about anything else except, nothing's wrong with that. But yet I've had three people in my history of doing this. They'd walk around with their, how many watch the old movies in the Western with the guy with the divining rod trying to find water? Or if you ever did the Ouija board, that's what they would do. Walk up and down the aisles until they find the machine. This machine right here is going to give me money. So I sit down, nice comfortable chair. I don't even have to lean forward. My card is right on the lanyard. And I just start playing. I'm up $5, down, been doing this for 30 minutes now, an hour. Up, down, but it's, not hurting anybody, right? I'm having fun. But all that free coffee and pop, I gotta pee. But I can't. If I get up, even if I put my stool up against this, gotta watch out. This lady right here is gonna come over, put her card in and steal your money. So I continue to play until all of a sudden, bing, 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 you hear the jackpot. You hear metal coins hitting a dish. You never put any money in it, but it's just, I won, but I also just peed myself. But do I leave now? No, the machine is hot. I'm going to continue playing until all my money's gone. And thank goodness I remembered to put my Depends on. You know, unfortunately, men and women have been known to put catheters in themselves to extend their play. To me, that's an addiction. That's something's wrong, right? But back to the sports gambling, sports betting. How many were sick and tired of those commercials from January through March? Every other commercial, you know, but I'm very proud of Ohio and our folks because they fined over millions of dollars to these companies for not having the 800 number listed or a helpline. So we're on it. Ohio is on it, and we're in a lull right now, but guess what? Football season's coming. So any questions or anything? I can go on for hours. I'm very passionate about this, but we're out of time. So any questions? If you want more information, just get on maryhaven.com. We have our website. It's a gambling intervention, and we have all kinds of stories, self-tests, things like that. Or give me a call. My number's on there. Just reach out. I'll be glad to talk to each and every one of you. Please.
And not any details, but how did you begin to put a stop to the gambling addiction or person?
Well, like I said, I make the sell. You know, usually I'll say, well, you know, you're here, so you must be really bad at gambling, or you don't know when to get up and leave. That's the big thing. But when you're in that action, the cognitive distortions, you know, oh, it just came this close to winning, so it's going to hit in the next couple spins, you know. And if you win a jackpot, majority of my folks give it all right back. So
I have a 93-year-old that's been doing it for 17 years or more. And even before, you know, with the old behind the scenes numbers racket.
Yeah.
Started there, then the lottery came up. And so almost every week she spends not a lot of money, $10, $20 to play. And she wins, she's happy.
Well,
It's like a game.
but it's entertainment. He's okay.
Yeah, so I don't worry about it.
Yeah.
She's 93 now.
Anyone else? Reach out if you have any questions.
Thank you, Bruce. Thank you very much.
Thank you, Pam.
So we are almost right at time, but I want to invite Andrea Wilson, Chief Community Services Officer for Primary One Health, to offer some final updates and announcements. And I want to thank Primary One Health on behalf of Franklin County Public Health for helping us or allowing us to co-sponsor today's breakfast. And it's been really a great conversation this morning. So turn over to Andrea for some final comments.
I'll be quick. I know that we're approaching, past our time. So as you kind of heard earlier, Charlita's on a well-deserved break. She's our CEO. So you get me today instead, just to thank you all for being here. Thank you, Franklin County Public Health, for co-sponsoring this. We do these breakfasts to bring information and awareness to the community. So I hope that's what we were able to do today. I appreciate all of the robust conversations that happened. I'm glad that you all were able to make it. Just want to thank some of our staff who make days like today happen. We have Nicole Gomez in the back. She's our Chief Patient Experience Officer. We have Grace Hall. She's our Marketing and Communications. I don't know your title. Specialist. I think she does everything. We have Rose, who's back here. She's an intern with us helping, and she helped us get today going. DeWitt Harrell was here earlier. He's our Chief Financial Officer, but he had to step away for another event. It's a busy weekend for us. And then I saw a couple of board members. I saw Erica McGriff, and I saw Dr. Mary Bynum was in the back. I think she had to leave as well. And I think we have a friend from OECHC here today, maybe. So I appreciate you being here. Thank you for coming. And then just to let you all know, our next produce giveaway event will be August 5th at our Agler Road location. So if you know folks who could use the produce or want to come out yourselves, please join us. We have some grand openings coming for some new health centers. We're opening a center at Alum Creek on August 10th. And we're opening our second school-based health center with Columbus City Schools on August 16th. So please join us for those. The information can be found on our website. And last but not least, please take some food with you as you go, because there's plenty left. So thank you all.